and welcome back to our OptiFast Lifestyle Education Series. Today we're going to be talking about measuring your progress. Measuring different parameters of your progress is going to be really important, and it is really important in staying motivated and tracking how well we're doing with our fitness measures as we go through the progress or the process. A couple things we're going to cover today is how to measure your resting and your heart rate during physical activity. We're also going to be talking about doing a simple walking test to help you assess your physical fitness status. And then we're going to be talking about measuring body circumferences. So as far as measuring your heart rate, there's several places where you can measure your heart rate. Basically what it is feeling a pulse or an impulse of when your heart beats and sends a pulse of blood through the arteries. And you can feel those whenever there's an artery that's close to the surface. For example, you can feel your carotid pulse in your neck. You can also feel your pulse in your wrist here. Sometimes you can feel your pulse up here in your temples. And then you can also feel, if you just place your hand over your heart, you can feel that beating. So whenever you're measuring your pulse, you want to use your your index finger, your middle finger, both of them together. Try not to use your thumb, because sometimes people can feel their own kind of pulse beating in their thumb, and it can get a little bit confusing. But you want to have a stopwatch, and you want to count how many beats you feel or how many impulses you feel after you find the pulse pretty strongly for 60 seconds. And that will be your heart rate, because that's how many beats per minute. If you want to do it for a little bit less time, you could count it for 30 seconds and then just multiply by 2. In general, the lower your resting heart rate is, the better fitness you have, but it doesn't always indicate that. Sometimes people are on medications that will slow their heart rate, like beta blockers or calcium channel blockers. Those are things, medications like metoprolol, propranolol, atenolol, amlodipine, diltiazem, verapamil, those type of medications. And those will kind of inhibit your pulse from going fast. But outside of those types of things, typically you can get a good assessment of your baseline physical fitness just by testing your heart rate. And that's something that you can do in the privacy of your own home. You don't really need a whole lot of equipment. Another important measure, and this will kind of help us determine how intensely your cardiovascular activity is or your cardiovascular exercise is what your heart rate is during physical activity or during exercise. So whenever you're once you're through your warm-up and you're getting going, you'll want to stop periodically and assess your heart rate. And you want to start counting like as soon as you stop exercising to break. You can put your hand over your heart, and then you can just count it for 10 seconds. You've got your stopwatch, let it go for 10 seconds. See how many beats are in that 10-second period, and then multiply that by 6. And that'll give you your beats per minute. In general, when we're talking about different levels of activity or intensities of physical activity, moderate intensity cardiovascular exercise is considered somewhere around 70% of your maximum heart rate, and high intensity physical activity is considered around 90% of your maximum heart rate. So in order to determine what that is, you would take 220 minus your age and then multiply that by either 70% or 90%, and that'll kind of let you know as far as if you're engaging in moderate or high intensity cardiovascular exercise. So the next measure of progress that I want you to kind of focus on is something called a simple walking test, or a 6-minute walk. So to do this test, you're going to try to find a particular course. It could be really anything. It could be walking around your block. It could be walking the track at a local high school. Really anything that takes about 4 to 6 minutes to complete. It doesn't have to be necessarily strenuous or have inclines or declines or anything like that, but it's just to get kind of a baseline. When you do the test, you want to do it in comfortable clothing, comfortable walking shoes. Don't do it within a couple of hours of eating. and you want to make sure that the weather is permissible for, not too hot. If you live in a hot climate, make sure that you kind of do it early in the morning or in the evening, and where it's not too humid out, if you're going to be doing it outside. But kind of choose your course, something that takes around 4 to 6 minutes for you to complete, and you want to go ahead and have a timer, set your timer, and do it at your regular pace. After, and then make sure that you set your timer to see how long it takes it from start to finish. After you've completed the course, then I'd like for you to go ahead and take down your heart rate, and also make sure that you're checking the time to the second of how long it took you to complete it. After a few weeks, you want to go back and try doing it again in the exact same conditions that you did it the first time, and compare. If you're working hard at increasing your activity level week by week, and trying to become more physically active day by day, then you should see your heart rate come down as you do it, as well as the time it takes you to complete the course. So that's the simple 6-minute walking test. Another thing that's important to kind of track, and I think that I've talked to most of my patients about this, is tracking your weight. And you want to do this on a fairly regular basis, at least once a week, for example. Getting on the scale under the same circumstances each time. So I usually tell people to take your weight in the morning, after you use the restroom, when you're dry, before you get, before you take a shower and are wet, with minimal clothes or just your undergarments, with your scale kind of on a flat surface, so that you kind of have everything kind of the same and nothing else interfering, like shoes or clothes and this or that, so that you kind of get your regular baseline weight, and then record it so that you can see trends over time. That also helps to kind of keep us on track too. And the last thing I want to talk about, ways that we can measure progress, is by measuring our circumference. So circumference is your measurement around something. You want to have a good measuring tape. This one I particularly like because you can do it easily with one person, and it kind of closes in on you. But this measuring tape, you put it around you, and then it kind of sticks in the other side, and then you can push a little button once you get it kind of loose around the spot that you want, and it tightens up to you. It's called the Myotape, but there's plenty of different measuring tapes, or you can just use a regular one. But essentially, a couple different places that you'll want to kind of keep track is your waist circumference is particularly important. Hip circumference, you can measure chest, upper arm, and thigh. But the waist is probably the most important. That one actually has been shown to be linked to to increased risk of type 2 diabetes and cardiovascular disease if the waist circumference is more than 35 inches for men and more than 35 inches for women and more than 40 inches for men. So it's actually a pretty useful parameter for identifying risk factors for health comorbidities and problems. But to measure the waist circumference properly, so I kind of want to go over this. You want to do it with your feet flat on the floor, feet together. If you do it in the privacy of your home, it's probably the best way to do it, because you want to do it without your clothing on, or maybe just your undergarments, and with a mirror in front of you. That kind of can help make sure that you have the tape kind of nice and even, because you want the tape to be horizontal to the floor. And then you'll find the area of your waist that is kind of where you have kind of a natural indentation, or the leanest part around the middle. And then you want to make sure that you don't pull the tape tight, so you don't want to kind of pinch your skin or anything like that, just where it's nice around the outside, again horizontal to the floor. And then if you have a tape like this, it'll close nice and easily. And then as far as where to take it with inhalation and exhalation, your measurement, you want to do it at the end of exhalation. So that's where you'll find the spot. And usually you want to take it a couple times. So maybe take it 3 different times and then average those 3 to get an accurate measurement. So that's how you do the waist measurement. The hips, with doing the hip measurement, you do it in a similar way. Obviously the inhalation, exhalation doesn't matter. But again, feet flat on the floor, make sure that the tape is horizontal to the floor. And with the hip measurement, you find that area where it's the widest around the buttocks. And then with the upper arm circumference, you want to do it over the belly of the bicep, so just halfway between the shoulder and the elbow. And then thigh measurement, also halfway between the hip and the knee, sort of halfway between the hip and the knee. Actually, you find where kind of the where you kind of have a little indentation where the bottom, where your glute or your buttocks changes into the leg, and so halfway between there and your knee is where you'll do that measurement. And then on your packet that you should have at home or are getting in the mail, if you don't have it already from clinic, there's a personal progress chart. And this is really useful to kind of keep yourself on track. And it's really motivational too, because as you go along, as the weeks go by, sometimes we can see inches coming off before we see weight coming off, especially if you're doing resistance training and you're gaining muscle and losing fat. Sometimes your body composition will change, and it's really nice to see those inches coming down. So they've got, you want to make sure you put in the date, your weight, your resting pulse, your walking test, waist, hip, chest, upper arm and thigh, and how to do all those measurements. And then you can check them out every week or every couple of weeks to see how you're progressing. So last but not least, as we're kind of making these positive changes in our lifestyle with healthy eating and regular physical activity, this is kind of a good time to take a lifestyle inventory to see how we're doing as far as healthy habits in other areas of our life. So on the packet there is a little questionnaire that you can feel free to go through and see how you're doing in a few other areas. So I hope that this little talk was helpful, and if you have any questions, please feel free to message me or ask me in clinic, and good luck. Have a great week. Bye.